Constipation is one of the most common concerns that parents have about their kids. And honestly, no one loves talking about it. What makes it more confusing is that not everyone agrees with how constipation is defined in kids. Should kids poop every day? Should kids poop every few days? Some people have been told that it is normal for kids to not poop every day. Some have been told that it's normal for kids to poop multiple times a day. What is really the real normal here when we talk about having a healthy, regular bowel movement? To help clarify some of the confusion around constipation, here are the 5 biggest misconceptions that I see as a pediatrician from working with thousands of parents and children. Hi everyone, I'm Dr. Eileen Shi, a board-certified pediatrician who works holistically with parents who want a child-centered approach to solve their children's health issues. So if that sounds like you, don't forget to subscribe to the channel for more content just like this. I want to start off by stating that constipation simply means an interruption or disturbance to having regular passage of stool from the body. When we eat food, the food moves through our digestive tract in a stepwise fashion where it gets broken down into smaller parts. Part of it is absorbed through the intestinal lining and shuttled to different parts of the body that makes use of the nutrients. And once all that absorption and digestion have occurred, what is left is that's not absorbed gets pushed out eventually, resulting in a bowel movement. When there's an interruption to this final step, there can be a buildup of waste in the body. Over time, that waste buildup can expand in the colon, take up space, and foster unhealthy bacteria overgrowth that can lead to other disease processes and cause physical discomfort such as pain, urinary obstruction, and distension. In theory, having a healthy bowel movement should be a daily vital body function, just as breathing in air and oxygen, or having to empty your full bladder, or having a robust fight and flee neural response to something that's stressful. But when it comes to this vital body function, such as pooping, it is a little bit more complicated than that. So the simple question is, isn't pooping a thing that just everyone does? This is one of the biggest misconceptions of constipation. Not everyone has regular bowel movements, especially kids, because it is regulated by the nerves in the digestive tract. Kids, just like babies when they're first born, are still learning to make that mind-body connection that cues the bowel movements. So factors that play a key role for having healthy bowel movements are having a daily routine that allows one to sense the need to poop, being able to use the bathroom without being rushed or watched. So think about picky eaters who don't do well with too much attention and pressure to eat certain foods. Kids who struggle with constipation can similarly experience a lot of pressure and attention around pooping, making it more task-oriented and stressful for the child and the whole family. And just as with picky eaters, we can't force how much your child eats. When working with kids with constipation, we can't control the whole process in hopes of just fixing it on the spot. What we can do as parents is to provide a daily routine that gives your child freedom to use the bathroom, some structure in prompting them to try to use the bathroom, and a healthy diet that promotes regular bowel movement. Number 2, fiber makes constipation worse. A lot of parents tell me this: eating too much fiber will make things worse by clogging the digestive tract. There is a misconception that having too much fiber in your diet will cause blockage because it is too bulky to pass through the digestive tract. Sure, I can see how one might come to that conclusion, but actually the opposite is true. A diet rich in fiber is essential in promoting regular bowel movements. Foods that contain high fiber, like stocky vegetables, leafy greens, legumes, beans, contain indigestible fibrous filaments. These act as cleaning bristles that remove the sticky waste products from the colon. In my other video on constipation, I talked about how sticky waste from foods that are inflammatory, like dairy products, processed foods, red meats, and binding foods like bananas, affect that. High fiber foods help clean out the gut lining, thereby removing the harmful waste that promote inflammation. Therefore, a diet that contains a minimum of 20 to 25 grams of fiber a day is essential to having regular bowel movements. Number 3, my child's drinking enough water. A balanced diet is not complete without adequate water intake. A lot of my parents would say, my child drinks water all day long, but chances are they need even more water. And here's why. Kids are constantly on the move. They are active, they're running around, they're expending energy and water throughout the whole day. They need water to replace their water loss from just being kids, and they need water for healthy bowel movements. The large intestine, which are the terminal part of our gastrointestinal system, absorb water into the colon to soften stool. You will see in children who are not drinking enough water, water will get shunted away from the gastrointestinal tract to be used elsewhere in the body where water is crucial. This results in hard stool. So how do you know if your child is getting enough water on a regular basis? The easiest way to tell is by checking out their urine output. Are they making light yellow or clear urine? This is a good way to gauge whether your child is properly hydrated. If the body is sensing that it's not getting enough water, it will make less urine and direct water to other parts of the body that need it the most, like vital organs and protein synthesis. By the way, if you found this video helpful, please give it a like and subscribe to the channel so that you will be notified of future content just like this. Here's another misconception. You can't be constipated if you poop every day. So time and time again, as a pediatrician, I would see kids who by report poop every day, but they're still showing symptoms of constipation. So having a bowel movement isn't the only indicator that everything is working properly to remove waste from the body. We also need to consider the appearance and shape of the stool. If your child is pooping every day but making pebble-like rock-solid poop, chances are they are still likely constipated, because hard and dry stools indicate that they have been sitting in the colon long enough where water has been absorbed out of it. And that also means that there is a slow transit time for moving waste out of the body. So not only the frequency, but more importantly, the consistency and appearance of the stools are the best indicator for whether your child has healthy bowel movements. In fact, in the medical world, there is an entire stool classification system called Bristol Stool Chart, developed in 1997 to classify stool based on its consistency and shape, which correlates with gut transit time. Your pediatrician may ask, how often does your child poop and what does it look like? Because the description of the stool itself gives us a clear idea of how fast the gut transit time is and whether there is delay or interruption to that process. The fifth misconception is that constipation is a temporary problem. It will work itself out. So many parents let constipation go on for some time before bringing it up with the pediatrician because in addition to all the previously mentioned misconceptions, let's be real, it is so hard to tell when something is actually a problem. Constipation can come and go, especially if there's a change in your child's daily routine or a change in diet. But chronic constipation in children is defined as having irregular bowel movements for longer than 3 months' time. And if that is unaddressed, it may cause more severe symptoms like encopresis, which is soiling of the underwear in potty-trained child, painful and uncomfortable bowel movements leading to stool withholding and avoidance, and even poor appetite. Treating chronic constipation is dependent on the severity of the symptoms, rated on a spectrum from mild to severe constipation. For example, On the more severe end of the spectrum, say a child who has chronic constipation with frequent soiling of their underpants. And that means there is a backup so much poop in the colon that they are unable to control their bowel movements. In this case, this child might need more interventional treatments to alleviate their symptoms of constipation, like the use of laxatives, suppositories, and enemas, along with the appropriate imaging studies to evaluate the extent of the problem. Your pediatrician may recommend treating the constipation acutely before working on optimizing your child's diet and bowel routine and other lifestyle modifications. Taking a holistic approach to treating your child's constipation means addressing the root causes of the constipation, but also being able to triage and treat acutely when constipation is severe and causing daily disruption to your child's daily living. And as we have covered in this video, treating constipation and promoting healthy bowel movements involve many moving parts, from having daily routines to a good high fiber diet to having a positive mind-body connection. In our Las Vegas-based practice, me and my team work with families one-on-one, offering concierge individualized care to each patient, holistically minimizing the unnecessary use of pharmaceuticals and treating root causes. To learn more about how you can work with us, click on Become a Member and fill out the information so that we can schedule a time to chat. Thank you all for watching. See you next time as we navigate the world of holistic pediatric medicine.